You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. With us, we have the go-to implant dentist in the tri-state area, Dr. Jonathan Abenaim. Dr. Abenaim, welcome back to the program.
Thanks for having me again.
Now, if you're an implant dentist, now I'm trying not to, people need to know that I'm not trying to just build you up here at the beginning, but everybody knows who you are, right? I mean, you've got, you're a manufacturer, you make the implants, you teach dentists from all over the world, I guess, on how to do implant dentistry. And we had a long discussion before this, and what I picked up on is that you actually care. You know, I just think of you as a businessman, but you actually care, right? So good for you. Now, you brought a stack of photos. We're going to try to get to as many of those as possible. And we've had you on at least, 5 other times?
Yep.
Now, for people that don't know your practice, like who's the typical implant patient that you see these days?
Typical implant patient could be a patient that hasn't been to the dentist in years, been wearing a denture, and says enough is enough. Typical implant patient can be a patient that's been to the dentist and their dentistry is not the way they want it to be, and they said enough is enough. But really, I would say it's patients that said, I just want to do it once, and I just want to do it right.
So if you had to categorize like the two main type of patients you get, what are they?
They would be the patient that's been in dentures for quite some time, and they said to themselves, that's it. I don't want to use glue anymore. I want to start tasting my food. I want to order what I want with my friends. I don't want to take my teeth out at night. I have a new relationship. I don't want anybody to know that I don't have my teeth.
Okay.
Enough is enough. The other one is, unfortunately, the patient that is on their way to dentures, and they say to themselves, well, I'm not going to do what my mom did, and I'm not going to do what my dad did, and I'm just going to have my teeth taken out and wear dentures. And they know that there's a solution where they can go from their broken teeth that they're not proud of to a gorgeous, beautiful smile in one day.
Now, just to clarify, I mean, you have a 3-step process. Step 1, you meet the patient, determine whether they're a candidate. That means if they could do it. Step 2, you design their smile. Step 3, they get their new teeth. Is that an oversimplified version, but is that what you're doing?
Pretty much so. You come in, you meet me, we take some records, we make sure we talk about your goals, decide what you want for your smile, decide how you want it to function. You go home, I plan everything before with my patented process, and you come back for the day of your surgery. In 2 to 3 hours, you have your brand new teeth.
Nice. Now, the tri-state area, I mean, but you reach beyond that, right?
Yes.
People are traveling.
Yes. We have people that travel from all over the world because they've realized that, you know what, although it may be a little bit far, I'm going to save so much time with this process. And I know I've seen the cases, I've seen the patients, and I know it's successful. And they are smart enough to say, I want to do this once, and I want to do it right.
Okay. And there's a trend, right? I mean, this is the future of dentistry, replacing teeth with dental implants, which means that there's a lot of new guys, new dentists that are doing this. What are your thoughts on that?
I think it's
and what do you want people to know, I should say?
Yeah, I don't think it's the future of dentistry. I think that dentistry has already happened. People don't accept dentures. They want to have dental implants done.
Okay.
But unfortunately, everybody thinks that they can do dental implants. Everybody thinks that they're an expert. And then we see it with the cases 2 or 3 years down the road. They're not the way they should have been. And then they end up in my office, and we have to have the hard conversation.
You're known as the guy that kind of fixes other people's problems. Is that correct?
Yeah, so we get to fix them, never badmouth anybody, always say, you know, this is what happens, and we get them to keep on going. Because the worst thing you could do to a patient is tell them to go from dentures to implants and then back to dentures. They don't want that.
Does that happen?
Unfortunately, when they come to my office, they never have to have that happen.
Okay.
But unfortunately, it happens because sometimes when there's a complication, the doctor is not equipped to be able to deal with it.
Okay, now, in your office, you literally print and make the teeth right there.
Yes.
Is that why you do it so quickly?
Yeah, so part of my 7 patents is how we're able to take all of this data for the patient, be able to digitize it into the computer, and because we have all of the manufacturing facility inside my office, we're able to make the teeth. But more importantly, you know, when I meet you and you say to me, you know, I don't want my teeth to look like this, I want them to look like this, I want them to be natural, I'm the person that paints your teeth. I'm the one that puts everything that you said to me into your teeth. Imagine.
Wait, you're the guy that makes the teeth?
I'm the one that makes the teeth.
Like
so I will do your
and
surgery.
Stains them and all that stuff?
Yeah, I will do your surgery. I will take the records to make your teeth, and then I will sit there with a paintbrush, just like an artist. and sit there and put the colors in your teeth so that they match your face, they match your smile, they match the color of your skin, they match everything, the twinkle in your eyes, so that it just looks like they were there the first time the right way. And
How is it normally done? Like you send it to a lab, there's technicians?
Yeah, so typically what happens the patient comes in, they say they don't like their denture, their teeth are falling out, then they say, well, okay, well, we see that you have this problem. Let me send you to my friend in town or 20 or 30 minutes away. You got to call another doctor's office, fill out other forms, make another appointment, be checked by another doctor, then go through the whole process, go to the surgeon probably take out your teeth, send you home in a denture, then come back to the regular dentist. The other regular dentist says, oh, this doesn't work, this is the wrong thing, and then you're in a big hamster wheel of implant dentistry, and if you're lucky, 2 years later, you get your teeth. In my practice, I'm the doctor, I'm the restorative dentist, I'm the artist. Everything is done in-house. There's no ifs, ands, or buts.
So you do this like every week? I mean, this is pretty much the focus of your practice?
This is what we do every single day. We're a full arch implant office. This is what we do. And then when we're not doing it, we're innovating, we're inventing more and more things. And when we're not doing that, we're teaching it around the world.
Now, this can be done in actually 2 appointments, right?
Absolutely.
I mean, you probably prefer 3,
yeah,
right? But 2, like they could go in, meet you, they say, I want to do this no matter what.
I mean, they can have their teeth in 1 appointment.
Have you ever done that before?
Absolutely. We do it every day. And one day, we take out their teeth, put the implants, and the same day they get their teeth. There's no dentures. There's no sitting in the office for 10 hours. We get this done in under 120 minutes. Done.
Is that right?
Yeah. And it's because we've been doing this for so long, because of our patents. And when I say my patents, because of my inventions, because of how we've really studied, how I've studied this to be perfect, and how, like I said, I'm obsessed with this. This needs to be perfect for the patient because this is their 3rd set of teeth.
Okay.
And this is the last chance. And I take it upon myself to make sure that the patient gets what they need. Because I don't want them to have to go to dentistry again. They come and they visit us, have their teeth cleaned every 3 to 4 months, but that's it. So we really obsess to make sure that everything is exactly the way it's supposed to be. That's the way it should be. This is a surgical procedure. This is a big deal. This is not just, oh, I'm just going to go through, drive through, get some implants and leave. This is extremely important. And this is why patients come from all over the world to get this done. I'm going to share you, I'm going to show you some cases and some patients that their story is truly unbelievable. They've driven 2, 3 hours, sometimes 10 minutes, sometimes 3, 4, 5 hours, stayed in a hotel just to have this done. And every time I ask them, was it worth it? They say, yeah, I drove by 100 dentists, 200 dentists, but this is the place I'm going to be. I have patients that move out of state and they fly back just to have their teeth cleaned because they understand to get this done right and to maintain it right is everything, because the least amount of problems are when you preempt them.
So when it's done, how soon can they eat?
Listen, in the beginning, right away, they have to eat, and that's on a soft diet. They make sure that they eat all the nutrients that they need to be able to heal themselves. But before you know it, within a couple of weeks, they're eating what they want.
Do they ever send you photos of like what they're eating, or do they ever call worried saying, okay, I'm about to have my first steak?
Yeah, they get a little bit nervous, but it's super interesting. All of a sudden, their life changes in a sense that they eat healthier, they start exercising, they care so much more about the way they look, the way they feel, the way they dress, everything. They get new jobs, they get new relationships. It's, people say all the time, oh, I'm changing the patient's lives. No, I'm not doing anything.
Okay.
All I'm doing is giving them the tools to be able to change their lives. Because let me tell you something, Randy. If you don't wear a denture, or if you don't have any broken teeth, you will never understand what these patients go through and how it blocks them from living the life that they want. When they take that part away, that they think all day long about their teeth,
Really? They tell you this?
They think about their teeth all day. Listen, they're talking. It's not like, God forbid, their foot hurts. They'll sit down or they'll hop around. They're using their mouth to talk, to chew, to do everything. And this is a constant problem that is on their mind 24 hours a day.
And in a way, it's an easy fix.
All of a sudden, you take that away from them, that they no longer have to worry about that. It's like they have so much more time in the day to do what they've always wanted to do.
Are you ever on a consult with a patient? They're telling you their hard luck story, right? You hear a lot of these stories.
Yes.
And they're hopeless in a way, meaning without hope. They don't think anything can be done. But do you ever get excited, like like you're thinking, they don't even know how good this is going to be?
Yeah. I sometimes say to them, I don't know if you see it, but I'm actually more excited for you than you are for you, because I can see the end. I always tell people, you have a beautiful smile. And they say to me, no, I don't. I'm like, you have a beautiful smile. Just the picture inside, I got to make it straight. It's like a frame. The frame is gorgeous. You're a beautiful person. Let me just fix the inside. And I promise you, you will never look back. And that's what's so amazing about doing this every single day. It's like I'm almost humbled and honored to do this for these patients, because wow.
Now, you told me a long time ago, you said the most expensive part about this procedure is going out to eat all the time and traveling.
Yes.
Is that right?
It's like people start investing in themselves more than they ever did, because I'm telling you, people hide. They feel bad. Their friends will invite them to the restaurant and they say, no, I can't go because I don't feel well, or I'm busy. And it's not really true. It's just they're embarrassed. You know, when most people go to the dentist or to the restaurant, they look at the right and see how much does that steak cost? How much does that chicken cost? Say, oh, okay, I can afford that, I'll do that. These people don't even look at the price. They look at, can I actually chew this? Will I choke at the table doing this? Can I swallow it? Will I enjoy it? Can I taste it if they're wearing dentures? And imagine how that shift is so big. You know, we talk about looking great,
yeah,
but it's not even about that. That's like, I would say, the side effect of this. But imagine having your life back. You know, like I'm telling you, I'll say this a million times. Imagine, Randy, you weren't able to go out tonight and eat what you wanted. How would that do for you?
Yeah,
every single day?
It would be tough.
3 times a day for 5, 10, 15, 20, sometimes 30 years. It really affects these patients. And I can see it like this. It changes them. It's unbelievable. I see the way they put their hair, the way they look, they lose weight, they feel better. Their personalities, even from the pictures, they go from not even looking at us when we ask them to take a picture from before to like the biggest smile in the world. It's amazing to see, and I'm so happy to be able to do this for them the right way, the first time, quickly.
And it doesn't cost more to go to a guy like you at the top of his game. Probably less because you do it once.
It doesn't, because you know what? We do everything in-house. So we control the costs for the patients. They don't need to go to 2 doctors. They don't need to have crazy labs do all of this stuff. Everything is done in-house. A lot of the parts we make. You know, it's my invention. It's my patent that we do this for the patient. So would you rather go to someone that read it in a book or the person that actually wrote the book?
Okay, good point, good point. Now you got photos.
I got photos.
And
I got photos that have lives.
Let's take a look. Okay.
So here's Bill. Bill is an unbelievable person. This man changes other people's lives. He works in the church. He helps people, changes their lives in the sense that he fixes issues that they have, consults with them, him and his wife. And for a long time, he was holding back. When you spoke to him, he sort of like held his teeth back. You don't see it so much in his smile because I forced him to smile, but you can see he's missing teeth. But take a look.
So his option would have been a denture.
He was wearing a denture that he wasn't wearing. You can see he's missing some of his teeth.
So even broken on the denture?
Broken on the denture. He was not wanting to wear it. Let me show you what it looks like when he's done.
Let's take a look.
Look at this. Look at his eyes.
Very nice.
It's truly unbelievable. Look how he's holding my shoulder. He feels like, even though he's way taller than I am, he is ecstatic. And you can hear him in the whole office. He's so loud. And his wife is so proud of him. And he did this for himself, for a person that for years, all he does was take care of other people. That's what he did. And a lot of the people that we meet, they take care of everyone else and they put themselves last. And they say, enough is enough. Now is time for me to take care of me. Why? So that I can take care of others. And that's what he did. And I was so proud to be able to do his case. He looks unbelievable.
Now, as far as pain, because I've talked to you about this before, but it seems so painful. But I guess everybody's numb.
Yes.
And they're sedated.
You know,
is that right?
Pain is associated with slow surgery. The longer it takes, the more pain the patient is going to have. Typical dentists will take 8 to 10 to 12 hours to do this. We do this in 3 hours. So the pain, the swelling.
So it's like, what, less trauma in and around the gums?
Less trauma, less risk of infection. All this stuff is just done really quickly because we plan everything before so that when we do the surgery, we get in and we get out. We don't just go, take a look, figure it out. Everything is done perfectly. Let me show you this other patient.
All right.
This is Pearl. So if you look at Pearl, you can see even in her before picture, she wasn't even looking at the screen. She was looking away. And Pearl had a denture. She wasn't able to chew what she wanted. She wasn't able to taste what she wanted. And she drove over 4.5 hours to come here.
Okay.
And she's one of those patients that drove by all the dentists. And she said to me, I don't want to come here so much. How is your process going to save me time, even though I'm coming from far away? And how are you going to give me my smile back? In one day, we took out the remaining teeth that she had. We placed her implants, and she's been wearing a denture for a long time. When she wore it, she didn't even wear it most of the time.
Wow.
We were able to place the implants that nobody else could have done. She's been to dentists. They said, no, you're not an implant patient. You're not a candidate. And she just wore her denture. She saw her sister.
But it is true. If you've been wearing a denture like 10, 15 years, you can't do this. You don't
That's
have
not
enough
true.
bone. It's not true.
That is not true.
Why do I hear it?
Because what happens is when you don't know, you don't know.
So it's based on training of the dentist.
Trainer of the dentist.
Okay.
If you have to go to a dentist, if you're not coming to see me, you make sure that you go to a dentist. You always ask me, who's a candidate for this? If you can get in your car and drive to my office, you're a candidate. And that's what it is. So back to Pearl, she didn't wear her denture. She came in from Maryland, drove 4 hours. She came back after her consult. She did her surgery. She came back about 3 weeks later. She had her teeth the same day. The denture, we have this party where we take the denture, we throw it in the garbage that day. And we say goodbye to it.
Okay.
It's like a farewell. Never again. Today's your birthday. It's the first day of
Do you have any
having
video
teeth.
of that? Of them throwing it in the trash?
We don't have it because it's a little bit private.
Okay.
But I'm telling you this is what we do. She had her teeth that day. She went home the next day, came back 2 weeks later. We put her permanents in, and she's done. Randy, I have a video. I know you don't show videos on the show.
Well, we try not to.
But I'm telling you, this is so powerful. It's important for people to see.
So what are we looking at right here?
Take a look at how we put in her final teeth. This reaction. It's truly amazing. They're like, wow, they can't believe it's them. Look how happy she is. It's like, they say, they feel like, wow. And what that is all of those things I told you about that they've holding on for. They've been holding on to all of this burden of not having teeth, not being able to chew, not being able to feel the way they want to. It's all gone because they've gotten to the end of the tunnel. It's not that long of a tunnel. And now they can start to live the life that they've always wanted.
Now, I met you about 6 years ago, I think, and you've become more philosophical. Yeah. Is it because you hear all of these stories after story of transformation? And what's the number one thing you've learned after doing thousands of these about the human spirit or what this does to them psychologically?
When we're trained as dentists, we're trained to treat teeth. And the more I hear these stories and the more I'm part of these transformations, I realize that the teeth is the easy part. When you've mastered your craft, it's like playing a violin in the Philharmonic. You know it by heart. You don't need to look at the notes. This is how we do surgery. This is how we do dentistry. But when you're able to treat the person, to understand their story, to understand the trauma they may have gone through, to really connect with them, it not only does it make you more empathetic, but it allows you to be part of their case. Like when I paint their teeth, all of these emotions that they shared is in there, and
really?
I put it into the teeth. That's why the patients that you see, the pictures that we show, whether it's on our social media, on your show, you see that these teeth look like they've been there forever. And that's really the key. You never want to have teeth that you look like came out of a box and you put in your mouth. If that's what your teeth look like by your dentist, they weren't done right. They need to look like we recreated nature.
And you know what? The truth is, it really, look, I know your fees. It's about the same wherever you go. But I guess the challenge is just finding a person that does a lot of these.
Do your research.
Do you walk in and just say, how many have you done?
I think you should.
Or call and say, how many have they done?
You never know. I think the doctor needs to be in front of you. You need to ask them, how long have you been doing this? Have you ever done a case like mine? Can you show me a case like mine? What's your success rate? How long is my case going to take? What's the possibility of complications?
But there's always a fear where you're thinking, I don't want the doctor not to like me. Like, these are kind of challenging questions. But so if you've done a lot of these, you're not going to be insulted by this. In fact, you probably welcome this kind of question.
I love it because at the end of the day, you know what? We may be friends, but we're not friends. You are hiring me to make sure that you have the best dentistry. And it is important for you to ask. And if you ask your doctor those questions and they get afraid, they're probably hiding something. I have no problem answering those questions because I've been doing this for 20 years. I'm going to show you another patient.
Okay, let's take a look.
Take a look.
I don't want to rush you, but we don't have that much time left.
This is Randy. Randy came in. He wanted to have his, he had no upper teeth. They were basically broken. And we needed to, he said, I'm not wearing this broken denture anymore. I want a new smile.
Now, with a broken denture or even a denture impaired, I mean, they can't eat very well.
They do not eat.
No such thing as a person with a denture that eats well.
They do not eat. Like, they don't eat the way that, they don't taste their food. That's not eating.
Because of what? The roof of their mouth
is covered? Yeah, the roof
of
their mouth is covered. They have plastic teeth. It's everything. It's not real. You know, it doesn't feel real. It doesn't act real. But more importantly, Randy came in, and Randy was ready to do the surgery. We're ready to go to do what we needed to do, but we need to make sure that he's healthy. So what we did is we talked to his doctor, make sure that everything is under control, and really got him on a plan to be healthier, to get his sugar under control. And within 3 or 4 months, his blood work was tip-top, and in 3 weeks, we finished his case. And look at how amazing he looks now.
This looks good.
Yes.
It's like he's proud of his smile.
And I'm just so proud of it.
Are people with bad teeth judged? Do they tell you that? Like they feel like people look at them like they don't have money or they're unclean when they have really bad teeth?
I think that people avoid them. There's two types. Either the people avoid them, whether they're in their business or socially they get avoided, but even more so, sometimes their children tell them. Or their grandchildren tell them because they're really honest about things.
Okay.
And they feel really bad. They won't, when they have a family barbecue, they don't want to be in the picture. When they have a family event, they don't want to walk down the aisle. There's all of these things that's stopping them from, I don't say this lightly, it's stopping them from living the life that they want. And they don't have to live this way.
But they don't get it until it's all done though. That means in their mind, they don't appreciate until it's done.
It's almost like they say to themselves, like, I don't need this. I got to take care of everybody else. I'm fine the way I am, until they're not. So why suffer when you don't need to? Come in. Let me help you. Let's get this done to change your life. Let me show you this patient.
All right.
All right, this is CJ. Another one, I did his brother's teeth. And when his brother told him how easy it was to get this done, CJ said, I want to get it done. Can you help me? His brother helped him get this done. And let me tell you something about CJ. He's an amazing person. He smiles unbelievably, but he was extremely shy. And you would never think. It's sort of like a teddy bear.
Okay.
And he was extremely shy. And he said to me, when I finished his case, let me show you what it looked like. Jonathan, you saved my life. And like I almost tear up when I say these things because I know the impact it's been. He comes in, he's the life of the office. And I can imagine how he's living his life after.
Let's take a look at that.
Take a look at that after. Look at it. He's almost like a 5-year-old that he's smiling. He's so cute. It's unbelievable.
Look, I can't help.
It's like being reborn.
I can't help. I don't want to be insensitive here. But, especially, it's almost hard to believe that it's that big of a deal for people. Like, terms like life-changing, everything changes in their lives. But you say it does. You've witnessed it firsthand.
It's a burden that they carry in private. Because remember, you can close your mouth and nobody will ever know you don't have teeth. That means you could be the quiet guy in the room.
Okay.
You can be the shy one and you can hide your way through it. But that burden affects you. And it doesn't allow you to do things that you want to do, whether you worked your whole life to be able to retire and travel and do that, and you can't do it. Because you don't have the teeth that you want. Your children are now getting married and you want to be able to smile for wedding photos or eat the food that at your daughter's or your son's wedding. How horrible would that be to not be able to do that? And they say, enough is enough. I have a wedding in 3 weeks. Can you do it? And we've done it. And we change these people's lives, not ourselves, but by giving them the tools to live the life that they want because they no longer have to worry about these things. And
the hardest part is, I guess, calling. Or making an appointment, right? Because nobody likes going to the dentist.
Yes, because like I tell my team all the time, the patients, when they call, answer the phone because it's so difficult for them to call. Because they're afraid of the dentist. They've been avoiding the dentist. They've been avoiding it because they haven't been to the dentist in years and they don't know what we can do today. I always tell people, I'm not your mom's dentist. I'm not your grandma's dentist. I am a dentist in 2024 where we have 7 patents. We use digital technology. We don't disrupt your life. We do this extremely quickly and extremely efficiently and extremely successfully.
Okay, I'm going to force you to brag about yourself a little bit here. I'm just curious on this. So like in basketball, in football, in sports, there's only a handful, like in basketball, Michael Jordan, and there's only a handful of the best of the best. Is that the way it is in dentistry when it comes to implant dentistry, in your opinion?
You can have...
Do you think you're one of those guys?
It's not that I think I'm one of those guys, but let me get back for 1 second. In high school, you could be the best high school basketball player. You can win all the awards, and all the seniors in high school think that you're the king of the world. But then there's Michael Jordan in the NBA. Then there's LeBron James in the NBA. Then there's Kobe Bryant. You are not in their league. And I can tell you that because we've had all of these successes, and we see the patients even after the fact, and they say to me, Jonathan, you saved me. Jonathan, I wish I would have done this sooner. Jonathan, it wasn't, oh, it was too expensive. Oh, I spent too much money. It was, wow, I wish I would have done this before. Not because of the teeth, but because of what it enables them to do, to not even be worried about everything. And that's, if you don't have teeth, like if you have perfectly healthy teeth, Randy, you'll never understand. No matter how many infomercials you do, you'll never understand what these people go through. And what they go through after, how they feel about themselves, is truly unbelievable.
Now, we're completely out of time. We've got about a minute left. But look, the cost of these things, no matter where you go, is not inexpensive. Dental insurance doesn't cover this. Medicare, Medicaid doesn't cover this. But you're telling me people are financing this. They're getting co-signers, things like that. You have to have okay credit. But is it really realistic? They're financing these?
Absolutely.
Across the country, or just?
Yeah, I would say probably 95% of my patients finance this. If they don't have good credit, they have a friend that has good credit, or a significant other has good credit, and they pay it off monthly, and they get this done, and they stop it. It's over. Now is their new life. It's their birthday for their new life.
Just by getting new teeth.
You say just by getting new teeth.
Because I guess, is it like in life, if something bothers you about your appearance, it holds you back?
Randy, will you do this show if you're missing your front tooth?
I guess I would. Dr. Abenaim, always a pleasure to have it on the show. If somebody wants to make an appointment with you, do they go to the website, make an appointment there, call your office? What do you want?
Both. Whatever you want. Call my office. My team will answer all the questions, schedule for a consultation, and I'm excited to be able to meet you.
You live, eat, and breathe this.
I'm obsessed.
You go home and talk about it?
All day long. I go home, I talk about it, I dream about it, I think about it. This is why I'm an inventor. This is why I'm a clinician. This is why I'm a surgeon, because every single day it gets better and better and better. Not for me, but for the patient's result.
Okay, and it doesn't cost more to go to a guy like you at all?
Because I make everything, because everything is in-house, because there's only one doctor, we control the cost for the patients, and we pass them savings.
All right, Dr. Abenaim, thanks again for coming on the show.
Thank you so much.
Stuff. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.